Hello, my name is Cameron Whitney. This is my presentation for my communications and documentation class. Today I'm talking about psychiatric patients, patients with different mental disorders such as schizophrenia, dementia, and also patients with general who are mentally challenged. So basically I want to talk about different techniques and skills you can use to communicate with them better so that way you can get more information out of them for your chart and also to build their trust. How to do that effectively. So first, I like to start with schizophrenia. That's a pretty common psychiatric disorder, especially in adults. You can find them in teenagers as well. When approaching these patients, a lot of times, at least I was growing up, you can be very skeptical, nervous. You get a lot of ideas and misconceptions from movies and Hollywood about schizophrenia. But they're patients, they're people just like you and I. They have mental disorder, they have problems, but it doesn't make them not human. So just approach them like they're human. So some basic techniques we can use is voice doubting. So when you have schizophrenic patients who are saying that they're hearing voices, these voices are telling them to do stuff, calling them stupid, telling them lies, and all sorts of things that can wear down on a patient. So one thing we can do is say that we can doubt the voices that they're hearing. So if they say, "Oh, the voices I'm hearing, they're telling me that the house is going to burn down," or "my best friends, they don't like me, they hate me," you can start saying things such as, "Well, I doubt that. I really doubt that your friends hate you. I doubt that your best friends hate you. I doubt that this house will burn down. Has good construction. We have whatever, we have smoke alarms," things like that. Make sure you say, you start doubting the voices, because then that can lead to them not trusting the voices and they'll start trusting you a little bit more. Make observations. So if the patient's in their room and you come in, you notice that the room is really messy, or maybe the caretaker had maybe brought them breakfast and they hadn't eaten it yet. Make sure you voice those things, you verbalize those things. "Oh, hey, I noticed that your room is kind of messy. What's going on with that?" Or, "I noticed that you haven't eaten your breakfast. Why didn't you eat? Are you not feeling hungry? What's going on? Are you upset about something?" Make sure you verbalize those things so that they can recognize and kind of bring them back to reality and what's going on. And on the topic of reality, make sure that you're presenting reality. If they ask you, "Oh, yeah, I'm hearing voices. They're telling me to do this. Did you hear that? Are you hearing them say this?" You never want to say, "Oh, yeah, I hear them. I hear what you're saying." Make sure that you tell the truth and say, I don't hear these voices that you're talking about. I don't hear any voices. I don't hear any voices telling you that the house is going to burn down. I don't hear any voices telling you that your friends don't like you." Make sure you present that and you brings them separate that that state of being in their head from reality. Another thing you can do to help the patient trust you and cooperate with you is by offering yourself. So, and by that I mean, if you're on a scene and a patient's not wanting to go, or doesn't feel or feels like they're by themselves, go along with the patient. Offer to help them grab stuff they want before they leave. Offer to get them a blanket. Offer understanding so that they know that they're not in alone. Maintain good posture. So let's say a patient could be frightening if they're acting kind of off the wall or maybe not appropriately. Don't act so defensive. Don't carry that defensive posture. Those things are picked up by schizophrenic patients. They want to be treated human, and if your body language says you're not, then it's easy to put up walls and become very defensive. So maintain good posture. Keep your hands visible. That allows patients to not one less thing to worry about. If your hands are hidden, they're not worried about, oh, what's going on, or the voices aren't telling them, oh, what are they doing with their hands? Something's going to happen. You can present your hands and they know that they're going to be safe. Stand still. It's one less thing to focus on if you're moving around and they have 1,000 other things going on in their head. You standing still is a constant for them and brings them some relief. Restating things. This helps keep the patient focused on the conversation as well. Because there's a lot going on in their head, most things are in one ear and out the other. So you might have to repeat yourself, and that's okay. Continue to restate things that you're trying, whether that be questions or things you want them to do. It's okay to do that. And build trust by keeping your word. If you say you're going to do something, make sure you do it. So if you say, I'll be right back, or if you say, I'll get you a blanket in the ambulance, make sure you do that. Don't ever lie to the patient. Make sure that you're building trust. Keep the questions broad and open. Open-ended questions are always good for psychiatric patients, schizophrenic patients. Ask them what's going on today. Don't have to tell them or say, you seem like you're in distress about this. What's going on with this? Just ask them what's going on today, and they'll probably point you in the right direction. And always give patients time to respond. So like I mentioned earlier, you might have to restate things. There's a bunch of stuff going on in this patient's heads, and it's really easy to become very irritated and agitated with people. So give them time to respond. And sometimes it's a very uncomfortable amount of time, but that's okay. Let them process the information that you're giving them. And a lot of times it'll benefit you because they'll have an answer for you. So just, be patient, let them respond. And if they don't respond, don't ask a different question. Don't ask a question and they think, oh, well, they're not responding. Maybe I'll get farther with this question. And if they don't work, maybe I'll get farther with this question. Maybe I'll get more information with this question. Don't stop trying to find the right track. Ask them a question and let them respond. Those are main things for schizophrenic patients. A lot of those can be applied to a lot of psych patients or mental disordered patients. The next sort of disorder I want to talk about or disease is Alzheimer's disease in patients that are having trouble remembering. This is some good techniques you could use to communicate with them and get more information for your documents, for your charts. Maintain good eye contact and get on the ground level, get on their eye level with them. So sometimes a lot of dementia patients will, or Alzheimer, dementia, those type of patients will have their eye visions will become tunneled and they can't see as well. So you might have to get on their level. If someone's talking to them and they can't see, they're probably not going to respond, right? So you make sure you get on their level and you can make eye contact with them. This is more for caretakers trying not to isolate those patients. A lot of times they already feel alone. Striking up small conversations and stuff with them is a good way to help keep them in a better state. So keep questions clear and simple. Don't ask too many questions at one time, and don't expect a ton out of them or them to respond super quickly, because they probably won't. It can be very difficult for patients with dementia to follow directions, partially because they can't focus. They have a lot going on. They're irritable. Their feet hurt, things like that. And those things, when they have that information overload, can also help contribute to that forgetfulness. So it's okay to use gentle touches for the patients. That helps them bring them back to a state of what's going on in front of them, helps them focus. Use pictures and hand gestures. So if they're hearing a lot of different things, but their eyes aren't seeing it, sometimes their eyes can be distracted. Their sense of sight can distract them from what's going on. So if you can use hand gestures or pictures, that helps align all the senses to one focused thing. So try using that. Mitigate distractions. So if the TV is on super loud, go ahead and try turning that off. If there's a dog barking in the room, maybe consider removing the dog. crying family members, might be a good idea to ask them just to step out. So that will mitigate the high volumes and the distractions. Repeat questions, like I said, that's also with schizophrenic patients. It's okay to repeat your questions to patients with dementia. That helps them bring them back to what you're trying to ask them and focus. Something else that you might want to consider is I would say might want to consider, you never want to argue with dementia patients. Getting a dementia patient irritated or agitated is a real quick way to not get anything else out of them. Try to make them feel comfortable. If a question is starting to irritate them, maybe steer clear of that question or that topic. The next super broad patient I'd want to talk about is the generalized mentally challenged or maybe developmentally challenged patients. And these patients can become upset. I think a lot of us grew up in schools, at least in my experience. I grew up when I was in school, I had people in my school in my grade that were developmentally challenged. And I always found it kind of difficult to communicate with them because I didn't know how. So this was actually super insightful for me, things you can do to make that a better experience, to make it more effective, especially being a paramedic or an EMT when you're charting. So first is, before you even step in, if you know that the patient is mentally challenged, just take a second, take a beat, take a deep breath, and it sounds silly, but center yourself. So just make sure that you're composed, because it's going to be a challenge. Face the patient directly, kind of steering off and trying to talk to two people, maybe their caregiver, or also maybe their parents there, and you're trying to get information from their parent instead. Doesn't help them focus. If you're not focused on them, they're not going to be focused on you. Open your posture. Don't be super closed out. This is kind of going to schizophrenia patients. Having that posture of openness allows them to know that you're wanting to listen to them. You want to hear what they have to say. So don't let the mean things that they say hurt you. And this is something the mentally challenged patients sometimes don't understand. What they say is going to hurt somebody. Maybe they've heard these sayings and these phrases before, and so it's just a reaction to say these things. They don't know how to filter sometimes. And you have to understand and not take that personally and keep your professionalism. You never want to respond to anger with anger. So make sure that you keep your composure, stay professional, and continue asking questions about what you were trying to figure out. Keep good eye contact. Repeat your feeling statements. So if they're saying things like, I'm just not happy, or I'm upset because this person did this, it's okay. Reconfirm those things to them. Say, oh, so I hear you're feeling upset. That helps you make that connection and relate to the patient. Verbalize that they're feeling better. So if you get to the end, or you're in the ambulance, or wherever you are, whatever your job is, and you've talked to them and they're kind of being more cooperative, make sure that you tell them, so I feel like you're feeling a little bit better. That helps them make that connection to that, and they'll say, oh yeah, I am feeling better. Yeah, I am feeling better. Speak to the patient, like I said, not their mom. They're people. A lot of times people will assume that because a patient can express what they want to say with words or emotions, or emotions, people assume that they can't understand our words, which a lot of times is not the case. And you can imagine how frustrating that would be. So talk to the patient, talk to them like they're adults. Don't talk to them like they're a child. It's okay to strike up chit chat on the ride to the hospital. Just treat them like a person. And I think that's generalized with all psychiatric patients. They might not be in the right mind, or they might be slow, or things like that, but they're still people. So always keep that in mind with psychiatric patients. I hope this helped you. I learned a lot researching about it. And yeah, have a good day.